But first tonight, a young girl dies from an infection associated with a severe respiratory virus that's spreading across the nation.
It's a story that was first breaking news live at noon today. Eyewitness News is working the latest on our top local story tonight. We know the girl who died was 10 years old and from Cumberland, and that it's the first death associated with Enterovirus D68 in Rhode Island. One other confirmed case has been reported in an adult here in Rhode Island.
Eyewitness News has live in-depth coverage for you, including what you need to know to stay healthy. But first, let's go live to Eyewitness News reporter Jared Pliner. He's live in Cumberland with more details on this tragic death and case.
Mike Shannon, good evening. Tragic, it is certainly that, and this young girl is remembered in a family obituary as a sweet child who loved Harry Potter and animals, and her shockingly abrupt death is bringing even more attention to a virus that is in nearly every U.S. state tonight. A Wednesday night of athletic camaraderie at Cumberland High School as locals digest the death of a 10-year-old girl who died of a serious staph infection after contracting enterovirus.
You take a perfectly healthy child one day and then the next day she's not with you anymore. It's very sad.
All of a sudden, for something as a minor cold turning into a major problem for a family, I feel really bad for that family.
State health officials said Wednesday the staph plus Enterovirus D68 made for a rare and disastrous combination.
It is, from an infectious disease perspective, really a perfect storm. It's not clear, what role the enterovirus had, but clearly the death was a sepsis death.
As of midweek, the CDC confirmed 500 people in 42 states and the District of Columbia had contracted enterovirus. 4 have now died, though the linkage to D68 is unclear. The Cumberland death has sparked a heated dispute between the town superintendent of schools and the state health department, as well as drawn ire from some district parents who questioned what was known and when. The superintendent claims he was told point blank last Monday the 10-year-old did not have enterovirus. He then communicated that to parents. But health department officials tell Eyewitness News it had not even received test results as of last Monday and could not have made such a definitive determination at that time. And school officials tell us district classrooms and buildings are being thoroughly cleaned. That is a good defense against viral spread. Live with the Blackstone Valley Mobile Newsroom tonight, I'm Jared Pliner, Eyewitness News.
This latest death and the news of polio-like symptoms accompanying some cases in Massachusetts can only increase concerns for parents as the virus continues to spread. That's why we spoke with the head of pediatric infectious diseases at Hasbro Children's Hospital to answer some of the most common questions about Enterovirus D68. What are the symptoms of Enterovirus D68?
For most people, it's just simply a cold. If the child has asthma or other lung disease, they may have more severe wheezing and coughing.
How is Enterovirus D68 transmitted?
Probably by respiratory droplets or by people's hands. Most likely, when you have a cold or a cough, people get their hands contaminated, and they end up then rubbing their noses and rubbing their eyes, and that transmits the virus.
When should parents take their children to see the doctor?
So especially if you're the parent of a child who has underlying asthma or lung disease and the child starts having breathing difficulties, that's when they should be taken in to be seen.
What's the best way to protect yourself and your kids from contracting Enterovirus D68?
Frequent hand washing. The other thing is, if you're sick or if your child is sick, please don't go to work or send your child to school, because they're going to infect other children at school, or you're going to infect your fellow workmates.
Dr. Dennehy also says there's no vaccine for enterovirus because there are hundreds of different strains. Count on Eyewitness News and WPRI.com to bring you the latest information on this developing story. Our coverage on air continues with Eyewitness News this morning starting at 4:30. And you can find extended coverage online right now, including more questions and answers about the virus and a fact sheet.